Known for creating innovative, cost-effective emergency care products that meet the needs of pre-hospital caregivers around the globe, Hartwell Medical is proud to introduce two new additions to the FASPLINT family of splinting solutions, the FASPLINT FULLBODY and the FASPLINT HALFBACK. Both new products provide spinal splinting solutions that are effective and affordable. This video depicts the application of the FASPLINT FULLBODY. The same principles are used when using the shorter version, the FASPLINT HALFBACK. Lay the FASPLINT FULLBODY splint out on a flat surface near the patient. The head and shoulder logo indicates the head end of the splint. Remove the red vinyl leashed cap from one or both of the maxi valves. Release any vacuum in the splint by pushing in the red valve stem. Keep the valve stem pushed in until the splint is pliable. Manually smooth out the beads to form a level surface. Connect the pump to the splint by fastening the pump hose connector to one of the valves on the splint. The pump can be attached at the foot end or the head end. Now evacuate enough air to make the splint semi-rigid. The objective is to be able to move the FASPLINT FULLBODY as a unit during the positioning and have the beads stabilized enough to place the patient onto the splint without pushing the beads to one side. With the correct amount of evacuation, the splint surface should be smooth but not dimpled. There are two methods for putting the patient on the FASPLINT FULLBODY and onto a scoop-type stretcher or backboard for transport. The first option is to use a Combi Carrier 2, scoop-type stretcher, or breakaway stretcher as a transfer means to first pick up the patient and place them on the splint, then apply the splint to the patient and pick them up again, now secured to the splint for transport. An alternate method is to place the splint on a backboard and then log roll the patient onto the splint and backboard at the same time. Let's take a look at each method. Place the FASPLINT FULLBODY splint near the patient. The splint does not need to be semi-rigid for this method. Apply the Combi Carrier 2 or scoop-type stretcher to the patient and use it to lift and transfer the patient onto the splint. Position the patient so their head is in the head circle and very close to the top edge of the splint. Remove the scoop-type stretcher from around the patient and proceed with the application of the splint. Another method is to use the log roll procedure. Place a semi-rigid FASPLINT FULLBODY splint on the backboard or transfer device. Holding the splint in place on the backboard, log roll the patient onto the board with the splint beneath them using standard patient care techniques. Position the patient so their head is in the head circle and very close to the top edge of the splint. Now proceed with the application of the splint. If the splint was semi-rigid, open the maxi valve at the foot end, allowing air to enter. Keep the valve open until the splint softens and begins to conform to the shape of the patient. Make sure there are sufficient beads to maintain neutral alignment of the patient. If necessary, pad appropriately to ensure neutral alignment, and always follow the protocols established by your medical director. Shape the splint around the sides of the patient head, making sure to fill the voids by the shoulders and neck of the patient. Do not shape the splint around the top of the head. Continue to hold these head blocks that you have formed until the splint is evacuated. A second person should hold the sides of the splint up to the hips of the patient until the splint is evacuated to ensure the splint conforms to this area as well. Some patients may be more comfortable with their knees slightly bent. Form the FASPLINT FULLBODY to meet the needs of the patient, using additional rescuers if required. Now evacuate the air from the splint using the valve located at the foot end. The head end valve can be used or both valves can be used simultaneously, but it is preferable to use the foot end valve because it makes it easier to work around the patient's head. Under normal conditions, the manual vacuum pump may require 25 strokes to achieve rigid immobilization. At higher altitudes, 4,000 feet and above, it may be necessary to use 30 to 35 strokes to completely evacuate the splint. To prevent accidental valve opening whenever a patient is being moved in the splint or when the splint is being put away, make sure to always place the red leashed cap over the end of the maxi valve. Finish securing the patient's head using medical-grade adhesive tape. Secure the patient in the splint to your rigid transfer device using the strap configuration best suited to the patient's injuries and your local medical protocols. Always make sure when tightening the patient restraint straps to avoid respiratory compromise or application of pressure to any injured area. Check the patient's neurovascular status and recheck all patient restraints prior to lifting or moving the patient. And always follow your medical director's protocols when using the FASPLINT FULLBODY and when securing the patient restraints. The FASPLINT FULLBODY and FASPLINT HALFBACK splints are both easily cleaned using soap and water, a mild detergent, or commercial cleaner disinfectant. Always place the red leash cap on the end of the maxi valve before cleaning the splint. Diluted chlorine bleach solutions may be used, but avoid prolonged exposure of the splint to high concentrations of bleach because discoloration is possible. A 1% bleach solution is recommended by the Centers for Disease Control. Always rinse the splint thoroughly after cleaning. Allow the splint to air dry or towel dry before placing it in its carrying case. Check the splint for leaks after each use by evacuating the air out of the splint and letting it stand for a few minutes to ensure the splint does not lose its vacuum. Small leaks or punctures less than 1/8 of an inch in size may be repaired by using the repair kit supplied with the splint and by following these procedures. Apply a drop of vinyl glue to the puncture site. Vacuum a small amount of air out of the splint to pull some of the glue into the puncture site. Release the vacuum, allowing air to enter the splint. Allow the vinyl glue to dry thoroughly for 24 hours at room temperature. Always store the FASPLINT FULLBODY and FASPLINT HALFBACK in their carry case to prevent damage during storage. Temporary field repairs may be accomplished using a small piece of non-porous adhesive tape or duct tape over the puncture site. For holes larger than 1/8 inch in size, please view the repair instructions for our EvacuSplint product line on our website, or if you have any questions regarding repair procedures, please contact our customer service department directly at 760-438-5500. As with any piece of EMS equipment, there are a few key points to always remember. Always check your equipment prior to and after use to ensure it is functional and will be ready in any emergency situation. Always follow your medical director's emergency care protocols. Always follow the cleaning and disinfection guidelines established by your medical director or EMS authority. Thank you for choosing another innovative product from Hartwell Medical.